Before I see my patient, I'm going to be looking through all of my patient history, checking our chart, seeing exactly where we're at. I think I have good understanding, so I'm going to be putting away my records. I'm going to get all of my equipment, which in this case is going to be my handy dandy DPI, I promise. And before I enter the room, I'm going to be doing some of my hand washing, make sure everything is nice and clean. I have all of my equipment. I am ready to go see my patient. Hi, my name is Liv. I'm a respiratory therapist at the hospital today. How are you? So I understand you've been at the hospital here for a little while with a COPD exacerbation. They sent me here today to be teaching you how to use your new medication. First things first, can I get your name and date of birth? Perfect, and I'd like to verify that. Perfect, 11/1/17. Very nice to meet you, Fox. So, how have you been feeling today? Oh, you're really tired? Interesting. Well, you'll be going home here soon enough. Have you been coughing much, having any sort of issues? Perfect. So, before we get started, I'm going to take all of your vitals here. I'm going to get your respiratory or your pulse rate. Get your respiratory rate. Take a listen through my stethoscope here. One thing I'm really paying attention to here is whether or not your lungs are healthy enough to have a fast enough inspiratory speed for this device. I'm going to listen at the bases first to see if there are any coarse crackles or anything that would exclude you from using this device. But you sound fantastic today. So, the medication that the doctor has prescribed for you is Ceravent. Do you understand exactly what all that medication entails, what it's going to do, and any sort of side effects it might have? Perfect. So, if you understand exactly what we're going to be doing today, I'm going to show you how we use this. So, this is a discus. We have different types of medications that can come in this form, some different types of anticholinergics, sympathomimetics, corticosteroids. Runs the gamut as far as what medications we can have in here. It's really good for asthma patients, COPD patients, adults or young enough or old enough children that they can have a fast enough inspiratory speed. So the way we're going to use this is we have a dial on the side that when we're ready to use, you're going to check your dose counter, make sure that you still have enough medication here. If you run out, just feel free to call and we can refill your prescription. We're going to take our dial, click it down. That loads our dose. Now, with these devices, the biggest con that we have with them is that they are prone to clumping the medication inside, particularly with humidity. So, in more humid climates, it's a bigger issue. Colorado's not too bad. But in this case, we need to make sure that we breathe all of our air out to the side, breathe out through your mouth. Once you're totally out of air, bring the device to your mouth, take one good deep breath in, take the device out of your mouth, and hold it for 10 seconds. Do you understand exactly how we're going to do that? Perfect. So I'm going to have you try if you're okay with that. I'm going to have you take a deep breath out to the side. Perfect. Take this to your mouth. Take one deep breath in. Perfect. Now hold your breath for 10 seconds. Perfect. We really like this device. It's nice and easy to use. Compared to an MDI, which you've probably used before, there you have to be able to depress it with a thumb, breathe in at the same time, coordinate the timing. With this, as long as you can breathe fast enough, one quick swoop, you're going to get enough medication. With those 10 seconds, we just let the medication deposit deep into your lungs so it can take effect. So now that we've given you a treatment, I'm going to let you rest here for a few minutes. I'm going to take off, and I will be right back in about 15-20 minutes to see how you're doing. Very nice to meet you today. I'll be right back. Hey Fox, how are you feeling? Feeling about the same after your treatment? Feeling better, feeling worse, any coughing? Perfect. I'm going to take another listen to you real quick. I want to make sure that your pulse hasn't done anything on. Breathing rate's still good. I'm going to take a listen again. And I'm hoping to hear that your lung sounds have cleared up from when I listened to them before the treatment. Again, listening at the bases first. Sounding much better. We're not having any wheezing, no indications that we're having any sort of negative adverse effects. So do you think you have a decent enough understanding of how we're going to use this? Is there anything else I can explain to you as far as pros and cons? We really like this device. I think you're a great candidate for it, and I think it'll help you quite a bit. So if you're comfortable with that, I'm going to make sure there's nothing else that I can get you, any water or anything. If you use this with a corticosteroid, I'd want you to wash your mouth out. Sometimes it's good practice just to brush your teeth anyway. But if you're comfortable comfortable, then I think I am all set here, and I'm just going to gather all of my equipment. I'll sterilize it when I leave the room. I'm going to mark everything in your chart, talk to your doctor, and I think you are ready to go home. So it's been very nice to meet you today. I appreciate your cooperation, and have a great day.